Good evening. The top story we are tracking: 3 weeks, 21 days of a curfew. This is not the Janta curfew the Prime Minister spoke about on Sunday. He said that this curfew, which he announced at 8 p.m. this evening, was much more stringent. This was about survival, about protecting ourselves from the coronavirus, and it was to ensure that those around us were protected as well. This is a war. It has to be done on a war footing. Social distancing isn't a joke. These are not normal times. 21 days is what the Prime Minister says is what is required to break the chain of transmission. If that doesn't happen, then we in this country are in deep trouble. But in all of this, the Prime Minister has now clarified, my fellow citizens, there is absolutely no need to panic. Essential commodities, medicines will be available. The centre and various state governments will work in close coordination to ensure this. Together, we will fight COVID-19 and create a healthier India. Jai Hind.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है। हिंदुस्तान को बचाने के लिए, हिंदुस्तान के हर नागरिक को बचाने के लिए, आपको बचाने के लिए, आपके परिवार को बचाने के लिए आज रात 12 बजे से घरों से बाहर निकलने पर पूरी तरह पाबंदी लगाई जा रही है। देश के हर राज्य को, हर केंद्र शासित प्रदेश को, हर जिले, हर गांव, हर कस्बे, हर गली मोहल्ले को अब लॉकडाउन किया जा रहा है। ये एक तरह से कर्फ्यू ही है। जनता कर्फ्यू से भी कुछ कदम आगे की बात। जनता कर्फ्यू से जरा ज्यादा सख्त। कोरोना महामारी के खिलाफ निर्णायक लड़ाई के लिए ये कदम अब बहुत आवश्यक है। निश्चित तौर पर इन लॉकडाउन की एक आर्थिक कीमत देश को उठानी पड़ेगी, लेकिन एक एक भारतीय के जीवन को बचाना, आपके जीवन को बचाना, आपके परिवार को बचाना, इस समय मेरी, भारत सरकार की, देश की हर राज्य सरकार की, हर स्थानीय निकाय की सबसे बड़ी प्राथमिकता है। और इसलिए मेरी आपसे प्रार्थना है और मैं हाथ जोड़ के प्रार्थना करता हूं कि आप इस समय देश में जहां भी हैं वहीं रहे। अभी के हालात को देखते हुए देश में ये लॉकडाउन 21 दिन का होगा, 3 सप्ताह का होगा। और जब मैंने पिछली बार आपसे बात की थी तब मैंने आपसे कहा था कि मैं आपसे कुछ सप्ताह मांगने के लिए आया हूं। आने वाले 21 दिन हर नागरिक के लिए, हर परिवार के लिए बहुत ही महत्वपूर्ण है। हेल्थ एक्सपर्ट्स की माने तो कोरोना वायरस की संक्रमण साइकिल तोड़ने के लिए कम से कम 21 दिन का समय बहुत अहम है। अगर ये 21 दिन नहीं संभले तो देश और आपका परिवार 21 साल पीछे चला जाएगा। अगर ये 21 दिन नहीं संभले तो कई परिवार हमेशा हमेशा के लिए तबाह हो जाएंगे। और मैं ये बात एक प्रधानमंत्री के तौर पर नहीं, आपके परिवार के सदस्य के नाते कह रहा हूं। इसलिए बाहर निकलना क्या होता है ये इन 21 दिनों के लिए भूल जाइए। घर में रहे और एक ही काम करे कि अपने घर में ही रहे। साथियों, आज के फैसले ने, देशव्यापी लॉकडाउन ने आपके घर के दरवाजे पर एक लक्ष्मण रेखा खींच दी है। आपको ये याद रखना है कि घर से बाहर पड़ने वाला आपका सिर्फ एक कदम कोरोना जैसी गंभीर महामारी को आपके घर में ले आ सकता है। अब कोरोना के मरीजों के इलाज के लिए देश के हेल्थ इंफ्रास्ट्रक्चर को और मजबूत बनाने के लिए केंद्र सरकार ने आज 15,000 करोड़ रुपए का प्रावधान किया है। इससे कोरोना से जुड़ी टेस्टिंग फैसिलिटीज, पर्सनल प्रोटेक्टिव इक्विपमेंट्स, आइसोलेशन बेड्स, आईसीयू बेड्स, वेंटिलेटर्स और अन्य जरूरी साधनों की संख्या तेजी से बढ़ाई जाएगी। साथ ही मेडिकल और पैरामेडिकल मैन पावर की ट्रेनिंग का काम भी किया जाएगा।
Why has the Prime Minister made all of these key points? We're going to try and get details on that in just a few moments through some animation and some graphics. But before that, the National Disaster Management Act has been invoked. All states have been told that they now operate under that. The Principal Secretary and the Cabinet Secretaries have spoken to Chief Secretaries of all states. Now, there are important exceptions in all of this. Defence, Police, Public Utilities, Treasury, Fire Services, etc., etc. These are important, but I should also mention, and this is what a lot of people are worried about, that there will be nothing to come in the way of your basic food and water, sanitation, hospitals, medical equipment, groceries, vegetables, dairy, poultry shops, meat shops, banks, insurance, ATMs, all of that will continue to work as usual. But I want to move on now and take a look at some of the numbers over here and look at when China did its lockdown, when the US did its lockdown, and when India did. And I'll be joined in a few moments by Bhramar Mukherjee, the health data scientist, the chair of biostatistics at the University of Michigan School of Public Health. It's really important that we try and understand these numbers first. Let's bring this number of China up full screen if we can. Now, the date of the first death was on the 11th of China, within 2 weeks, on the 23rd of January. On the 11th of January is the date of the first death. On the 23rd of January is when the lockdown started. When that happened, 17 people had died. The number of cases was at 574. So what did China do? They locked down Wuhan. Later they moved to the Hubei province. But in the initial phase, it was 9 million people, primarily Wuhan residents, who were locked down. Now, let's compare that with the United States. The first case of death was the 29th of February. The date of lockdown took place almost 1 month later. And though the number of deaths at lockdown, similar to China, not very large at 21, the cases at lockdown were at 33,300. Now, this is critical. Why? Because it's taken the United States a month to actually get into that lockdown phase, by which time, even though the number of deaths was low, the number of cases has risen. Why? Because social distancing that we keep talking about has not happened in that initial phase. The extent of the lockdown in America, it's partial. At the moment, it's about 75 odd million people over there. Now, what is India trying to do on the basis of the knowledge that we've gained? Now, we got some time because the date of the first death was the 12th of March. So we got time to analyze the situation in China, America, and other countries. The date of the lockdown, again about 2 weeks after that, on the 23rd of March, so following the trend followed in China. At the time of the lockdown, there were 9 deaths. The number of cases, 433. But the extent of the lockdown, now all India, and the number of people in the lockdown, not 750 million, 1.3 billion. So while the other countries locked down much smaller numbers. We've just locked up completely. So, Brahmer, my question to you first, is a nationwide lockdown, as we see in India now, is that essentially the only way to prevent a large-scale loss of lives as a result of COVID-19?
So thank you, Vishnu. I actually definitely think that the lockdown is absolutely necessary, and I really applaud Prime Minister Modi's speech. And so in our mathematical modeling, we could actually model the effect of different intervention. So in a study released by the COVID-19 study group, we saw that you can remarkably reduce the probability of transmission or the chance of a susceptible person meeting an infected person. And so from Hubei, we can see data that the R number, the R naught that is being quoted, that the average number of person that an infected person can affect, that came down from 3.8 to 0.3. And I think that we can dwell with the little numbers, but I think that different projections are different things. Two takeaway messages are extremely clear, that without these restrictive measures, there was a sort of a tidal wave coming, and we had a picket fence to deal with the tidal wave. And so we can argue whether the tidal wave is 10 feet high or 20 feet high, or when is it coming? Is it coming in the afternoon? Is it coming in the morning? But the fact is that we need to buy time to build a dam, to build our capacity, to prepare the system in order to really face the tidal wave. And so this 3-week period lockdown is something I think from modeling approaches certainly very justified for India.
So will we flatten the curve in 3 weeks if we follow the rules?
So, our calculations actually show that, again, the numbers are actually quite changing, rapidly changing as data are coming in, testing conventions are being expanded. But what we have seen that it can come, so it's an exploding disease, but exploding virus, but it also can be controlled. That's the hope. That's what we saw people can give projections, but you have to take examples into account. What have we seen in China? What have we seen in South Korea? These are successes, so this can be accomplished. And so we saw that with strictest measures of lockdown, the number of cases can come down from 2.2 million to 14,000. Right. So this is the magnitude. So it's a reverse containment is also possible. So I think I really welcome this decision today.
Yeah, no, thank you for pointing that out. I mean, hopefully this will allow us to turn the tide on this. Brahmer, good to talk to you. Thanks very much indeed. Well, in all of this, there are certain heroes as well. We've spoken about our doctors, our paramedics. We've spoken about our police forces out there trying to ensure that people are at their homes. They're exposing themselves potentially to all of this as well. But there are inventors and innovators. For example, a made-in-India COVID-19 test kit is out. An India-based company, MyLab Discovery, has received an approval for its test kit. Each kit can study 1,000 samples from large labs. MyLab aims to produce 1 lakh test kits per week. It's expected to cost 1,200 rupees a test kit. Hasmukh Rawal joins us now. He is with MyLabs and somebody who's been at the center of this entire effort. Congratulations and thank you. Thank you. Frankly, I wouldn't have very much more to ask you beyond saying thank you, because testing is so important at this stage. Question number one, how soon is it going to enter the market for those medical practitioners who require it? Number two, how soon can you step up production?
So first of all, just to give you the news, we have already started the production as soon as we received the license yesterday. Our team was geared up and we wanted to serve the country fast. We are expecting the first batch release from tomorrow evening, and what we are doing is also gearing up our facilities as early as possible. So the projection of 1 lakh tests per week, we are planning to bring it to 5 lakh tests per week immediately, and we are prepared to go further as well.
How does this work?
Yes. And what I understand is massive screening is going to help us, because tests like
how does the test work? How does the reagent work? How soon do you get results?
So just to give you an idea, this kind of epidemic, you need to have a test which will be absolutely accurate. It should not give any false positive or false negative report, because if a false negative report comes and a person is roaming around, he may be the reason of infecting to the most of the people. So the test developed has to be 100% accurate in terms of sensitivity and specificity. WHO, CDC, all of those guys, they also recommend molecular testing technology to develop this. Luckily, we have been expert in this technology for last 8 years. We have developed products for our country which can go to the masses, and the test works from the sample to the result. It takes around 2.5 hours, which otherwise traditionally it was taking 7 hours as per the government, the current procedures which are followed in the most of the labs. So we can do more tests per day. Also, we take less space on the machine, so you can load more samples on the same time, and you can do more number of samples.
1,200 rupees a testing kit. Is that among the cheapest in the world?
So right now, the purchase price for us is, if you see the notification from the government as well, the 1,500 for a screening test and 33,000 rupees for a confirmatory test, and that's how it costs, because there are two kind of analysis you have to do. Immediately what we have launched is 1/4 of the cost, but we are prepared to go far below than that. But we have to gear up to command the price.
Superb. Thank you so much, and congratulations
Sure.
once again for making this happen. This is Indian innovation at its best. You've got young people over there like Hasmukh, just getting on with the job of protecting us. Thank you so much at a time when so much has been said about testing. We'll take a short break, come back with more.